Namaskar. Mahatma Gandhi said relationships are based on four principles: respect, understanding, acceptance, and appreciation. In the Legend series, we are bringing someone who has imbibed principles of Gandhiji with his own creative intelligence and passion for knowledge. Looking back with love. It is love that sustains quest for knowledge. Introducing someone whose tireless pursuit to seek new solutions for old problems with inquiry and observations makes him unique.
So LIJ was a community hospital in New York Tri-State. But people living in India or people who are academic in India, for them, Long Island Jewish Community Hospital was look like a great university hospital. Kanti Rai, though started his career in children medicine, but because it was the beginning of this specialty, so chairman of an adult oncology department, and subsequently he became a national leader of this disease.
While his achievements touched the sky, his feet remained grounded on earth.
He had been not only a president of American Society of Hematology, he is still continuing all his career and is still pioneer leader for medications, discovery, and treatment of CLL. And he has a CLL Foundation, and on his he was an endowed chair in Long Island Jewish Medical Center.
Dr. Kanti Rup Rai has become synonymous with the classification and treatment of leukemia.
It provided the doctor a tool with which to feel powerful, which, absent the clinical staging, was not available.
And that discovery or description, that classification of chronic lymphocytic leukemia is still valid and still being used for taking care of a patient of chronic lymphocytic leukemia who is severely sick and getting repeated increase in symptomatic aspect.
He embraces life with tender intensity. He's always encouraging for everyone around him. That is the expression of genuine love for humanity. It is love that sustained beauty of relations in the life of Dr. Kanti Rup Rai.
Important thing which influenced me for my lifetime is my marriage to Susan, and that was a life changing, made a difference for me.
Success and fame and recognition did not take away his focus to offer the best. As a researcher, as a physician, as a teacher, as a friend, as a husband, and as a father.
एक तो મારા chronic lymphocytic leukemia रो काम पूरी वजह से मने काफ़ी सेटिस्फैक्शन हुआ और डॉक्टर ने काफ़ी सेटिस्फैक्शन हुआ बिकॉज एक काफ़ी इम्पोर्टेंट अनसॉल्व्ड क्वेश्चन सॉल्व कर दिया.
We are grateful to him for giving us access to landmark turning points of his life. Our special thanks to Mrs. Susan, Dr. Shashi Shah, and Dr. Praveen Singhal made it possible to have memorable interactions with Dr. Kanti. He looks back at his childhood with loving memories. In the next few minutes, you will learn about the moments when love blossomed. It was 60 years ago, a very precious moment when the proposal of togetherness for life was made by Kanti ji to Suzanne.
I can see what made me decide to tell Susan that whenever you are ready, we can get married. That was the closest that I did in proposing without bending on my knees and presenting an engagement diamond ring or whatever.
It is a rare couple where wife still appreciates the articulate expressions of her husband. Dr. Kantiji's memory and ability to recollect many details vividly makes you admire him and question the strength of your own memory. Here is a universal mantra for success by Dr. Kanti.
Chance comes to the prepared, and therein lies the answer. And that unless you are working, trying, doing, you do not have a possibility of success coming to you.
If I put it differently, chance comes to the prepared, yes, but love needs no preparation. On the other hand, it prepares you to embrace life in its totality. While we look up with love towards Kantiji, is looking back with love towards the journey of his life prepares us to refine our own approach in designing our lives.
My memory of growing up in Jodhpur was with 15 children and 4 parents. My memory of growing up in Jodhpur was one continuous memory of love, give and take, periods of unhappiness maybe, but very short lasting.
Preparedness must have helped Dr. Rai in coming up with this detailed word picture of 8-decade-old visit to his uncle's hospital. And quoting from his response in an interview, he slipped the gloves on, the phone rang, he grabbed it, then an orderly rushed over with a requisition. My uncle was talking rapidly on the phone, signing papers, giving orders to a nurse. One man is still saying, ah, and the other poor man is on his knees. What excitement! I was hooked.
Dr. Kanti Rup Rai Jodhpur में my tremendous influence because he was a happy, honest man and a doctor.
Please bear with the poor audio quality. Absorb the presence of simple, kind, and humble great man whose love and respect for every human being also makes him a very special person. My uncle used to do things for everybody, regardless of that person's social, political, financial stature. Dr. Kantiji was born at Jodhpur, Rajasthan in 1932 to Sri Kanti Rup Rai ji and Srimati Chandra Kaur Mathur. There used to be a bookstore bridge going into just one college. Rathi book. Rathi. Dwarkadas Rathi was a good friend, and I developed a great relationship. He was a great reader and a good guide. In 1947, at the time of India's independence, he was 15 years old. He's inspired by Mahatma Gandhi. He remembers Pandit Jawaharlal Nehru's speech and the impactful sentence, light has gone out. As compared to what we are today, Jodhpur truly was backward in 1940s, 50s. But my recollection was that All India Radio was a constant presence in our lives. Partition caused bloodshed
and the days of sorrow and real what India was not was the killings that took place in the aftermath of partition. Gandhi was assassinated, and his words were, "Light has gone out."
Dr. Kantiji's uncle played an important role in his decision to take up medicine. He studied medicine at Savai Man Singh Medical College, Jaipur. Those memories of 50s as student are intact in his mind, even after a gap of nearly 70 years. Perhaps he has the art of retaining all that is positive and that which adds to overall happiness. He makes not just Indian Americans proud, but also those who have come from the same medical college at Jaipur. Here is Dr. Shashi Shah.
I always proudly introduce myself that I'm from the same school where Dr. Kanti Rai is. And he's the witness that I did graduate,
Why he preferred America over Britain? The reason was rooted in his love for Bharat.
I had a built-in, not in anger, anti-England feeling because of my perception of what England did to the character of an average Indian. So I had no interest in going to England. So only other right possibility was America because I did not want to go to a non-English speaking country. I came in 1957, June, for my residency in pediatrics at Lincoln Hospital.
We were fortunate to have Suzanne ji and Kanti ji together. What did she learn about India as a student in America?
My education, I was born in 1941, so my education about history started in the 1950s. Anything beyond Europe did not exist in our education. I mean, the ignorance of what Indians accomplished before the English came, before the English tried to teach them anything, which I think is very typically American, that the colonizers were the great gift to the colonized people.
What were your first impressions about him? By that time, he had finished his residency and he was already.
And I had finished law school.
From where?
He not only finished his residency, he had gone back to India, he had worked at a national lab here, gone back to India, and come back from India. So we were seated.
It was 10 years after 1957.
Right. So we were both invited to a wedding in Boston, 4th of July weekend, by a family that my family knew and a family he knew. And I was trying to decide whether to go. And my mother said, "Oh, why don't you go? There's some doctor that Shirley, Room's mother, wants you to meet. Not as a date or anything. He's Indian. Nobody in my family ever married or even dated anybody who wasn't Jewish."
And now get ready to get insight on the concept of romance.
I think what his friends noticed is a sense of comfort with the other person, that they will always be by your side or have your back, would be supportive, would be sympathetic. It doesn't sound very romantic. and that you
Thank
would
you.
and that you would get along with each other. And, you know, I had one serious boyfriend before I met Kanti, and he even asked me to marry him. And I said, "Are you crazy?" That seemed to be my standard for this. I said, "Are you crazy? We fight all the time." And he said, "Well, not everybody has a tranquil marriage like your parents." Little did he know about my parents. I said, "Well, I want tranquility. I want not explosions and distress. And, you know, I mean, you have to respect the person. You have to enjoy the person's company. But comfort and tranquility, to me, is part of love. And that the other person will be there for you. If you're having a hard time, they'll sympathize. Even if they're in their hearts, they think you're crazy, or it's you who should be feeling bad about some interaction."
Here's a love story that unveils the beauty of life and depth of togetherness. Did Walter Mitty, a character in the novel of James Thurber, American writer and humorist, also played a role in putting a seal of oneness for them?
I decided, because of a conversation that we had on Fifth Avenue. So we had gone on a date, and we were walking up Fifth Avenue, and he said, "This is a Walter Mitty moment."
Walter Mitty was a character of Thurber who stood out because he lived in his own dream world. And we all have our dream world in which we live, and we sympathize and empathize with Walter Mitty's.
Then he said, "Well, I have a trip to go around the world. You want to come with me?" I said, I had a limited vocabulary. I said, "Are you crazy? I hardly know you. And besides, I have a job. And besides, I'm not that kind of girl. I mean, to go around the world with a almost complete stranger." But I did say, I'll meet you halfway. I'll come to India. You're going around the world. That way, I'm going around the world. This way, we'll meet in India. And my parents obviously were onto something sharper than I was, because they took me to the airport to see me off. And they said, "If you and Kanti get married," what are you talking about? "If you and Kanti get married, you shouldn't wait too long to have children, because he's pretty old, you're pretty old." I met him halfway. He wrote great letters on his way around the world. One of his friends, whom I did meet, kind of refused to speak English because he didn't think his English was good enough. Was a very accomplished and nationally recognized writer, not in Hindi, right? In Mawari? Biji. Hindi too?
Name? Vijayanand.
I knew him.
Baiji, Kantiji's mother blessed the couple in spirit, and his father also conveyed his love through his expressions.
My mother had died, and when she died, long before that, she said, "You marry anyone you like, and I will love her." And my
And
father,
she also said, "Even an American."
yeah,
She did say that. I wasn't there, but she told me.
and my father had a stroke and was not able to speak, but he loved Susan, and one didn't have to hear him say that because it was visible on his face and his body.
But it was very adventurous of him to come to America. And although it's probably hard for you to imagine now, it was very adventurous of me to go to law school. just wasn't done. It wasn't done by good students, and it wasn't done by women.
Why?
He said, "You want to go to law school? All the women lawyers I know are terrible people." But when you think about it, he was born in 1916. So the women who went to law school, let's say in 1935, were probably very, very aggressive, self-determined. That was not his style for women. And then he had occasion to see me in a work situation, and I'm very lucky. He was in his 90s by then. As I walked him to the elevator, he said, "I'm very proud of what you do."
Susan must have heard so much about Baiji's personality that when she talks about her, it is as if she knows her mother-in-law very well.
We know Baiji loves you, but I'm really her favorite. So she engendered in each child the feeling that that child was special to her.
When she died, all 15 of us in the funeral procession would touch each other's shoulder and say, "What are you crying about? It is my loss, not yours. So shut up." That was a real, honest response.
Both of them also share their approach towards parenting, favorite festivals, and the loving bonds with their son and daughter.
You celebrate holidays together with your children and anybody else. So for us, it's mainly Thanksgiving. Neither of us is really religious. We don't celebrate that. And we celebrate Rakhi when it's convenient. But Thanksgiving we gather. And birthdays we celebrate even if we're not together. And that was also from my mother. When your daughter asks you a question, because it was clear very early that she was interested in medicine, give her more than a one-syllable answer. So he's sitting there reading the paper. She asks him a question. He says yes or no, and then he puts his head back in the paper. I said, "No, this child is interested in medicine, and she is a fantastic doctor and teacher and human being." But I always felt that if he said he was coming home right away and he didn't get home for 2 hours, it was not because he was trading stocks or sitting and eating chocolates. It's because he did something that really mattered in the world.
And I think that my relationship with both my daughter and my son, who is 51, they both became closer and bonded with me in the latter half of their respective lives.
One is that our daughter is a doctor, and they talk about how to treat patients, how to deal with problems, not just hematology, but how do you relate to patients? How do you handle their concerns? And also now that our daughter is a teacher of doctors, they share that experience and that's relatively recent, maybe the last 5 years. So that's been strengthening the bond between Kanti and our daughter.
We had excellent relationship, loving, trusting, respectful relationship. It just comes. It requires effort and love. Happy effort, not a work effort.
What are the two top qualities of this legend, in the words of his wife?
You asked me about two adjectives to describe him.
Yes.
Generosity is one, humility is another. You'll never get him without those other doctors in the room to talk about his own accomplishments.
Dr. Kanti Rup Rai is soft spoken but firm. He has led an exemplary life with truth, honesty, integrity, and courage. He has a rare ability to make you feel good about yourself, enrich you with knowledge, and inspire you to excel.
That was 1957, and we are in 2023, and I am continuing my quest for knowledge.
Dr. Kanti Rup Rai has become synonymous with a classification and treatment of leukemia. He was moved by 3-year-old Laurie. In his own words, Laurie was diagnosed with acute childhood leukemia. Curable today, but in 1958 it was a death sentence. His paper on staging, reviewed by 2 hematologists, published in The Blood, changed the way clinicians approached the management of CLL. He was elected president of the American Society of Hematology. Dr. Rai has received American Society of Clinical Oncology's David A. Karnofsky Memorial Award.
Treating doctors, treating a patient with CLL, that doctor did not know or did not have any wherewithal to know that when he or she makes a diagnosis, a new diagnosis of CLL on a person, if it is advanced stage, which is easy to measure, does not require sophisticated instrumentation and machinery, but by your just simple examination enables you to make treatment judgment. It provided the doctor a tool with which to feel powerful, which, absent the clinical staging, was not available. I think that clinical staging at that time in 1970s made a tremendous difference for the clinician, doctor, as well as the patient. Thank you. He was treating people, still is treating people, with cancer, which is a scary disease. And so I mostly tolerated the fact that he was tolerated slash admired, that he was so committed to his work, his research, his patients. And I also understood after 1975, when he was the lead author on a very important patient, that he was actually making important contributions.
We conclude this celebration of his journey and recollect these words of India's former president, scientist Dr. APJ Abdul Kalam, who said, "Be active, take on responsibility, work for the things you believe in. If you do not, you are surrendering your fate to others." Dr. Kanti did not surrender his fate to anyone. He believed in himself. With pranams to Kanti ji and Susan ji, with thanks to Dr. Shashi Shah, Dr. Praveen Singhal, and to all of you. Thanks for watching. Looking back with love. The legend, Dr. Kanti Rup Rai. This is Ashok Vyas. Namaste.